Good afternoon, everyone, and welcome to today's STEM Symposium, hosted by the universities at Shady Grove, also known as USG. My name is Sarah Wells, and I am honored to serve as your host for the USG 2024 STEM Symposium series. This is our last series of the calendar year, but we are excited to return with additional activities, which we'll share more about in the new year to help you engage in learning and experiences around STEM and health and life sciences. So across this series, we have had several virtual events where we've explored a range of topics related to science, technology, healthcare, and more. I am so appreciative that each of you took time out of your schedules today, and I know some of you have been to multiple sessions of our STEM Symposium series, if not all. We are excited that you've joined us here at USG, which is an exciting place to learn. We hope that you're going to get a sense of the wonderful learning that takes place on our campus and in our community today. USG, or the Universities at Shady Grove, is a unique regional higher education campus located in Rockville. Degree and certificate programs from 9 top public Maryland institutions, including UMBC, which you're going to hear from today. In addition to degrees in STEM and health and life sciences, which we've been learning about through this symposium series, we also offer academic programs in a wide range of industries, and I will share a bit more about that for you later at the close of today's session. Here at USG, I oversee recruitment and transfer support, and we focus as an institution on making college easy and affordable. Please stick around after our speakers' remarks today. I will be sharing with you how you can further engage with USG and learn about how to prepare for your future career and academic success in one of the programs offered by our institutional partners, and how you can see your future here at USG. But first, we have a couple of housekeeping items related to today's symposium. We are excited to share that this symposium session revisit the learning that you've engaged in today later. We will be sending you a recording of today's session within the next 1 to 2 days. Additionally, if you find that you are curious about some of the discussion today, you can engage with our speaker by utilizing the Q&A feature at the bottom of your Zoom screen. You may use that Q&A feature throughout the session, but please note questions will be answered towards the end of the presentation, and our guest speaker will get to as many questions as they can. And so, it's time for me to introduce our subject matter expert and guest speaker today. We have with us Dr. Mark Shinnerman. He is a PhD and graduate program director for biotechnology for UMBC at the Universities at Shady Grove campus. He first today will introduce himself, and then we'll begin a conversation entitled, "What are vaccines and how do they work?" We hope this will help you, whether you are a current student, a future student of STEM, or a staff member or faculty involved here at the Universities at Shady Grove, to see real-world applications for the learning that you are engaging in. And so without further ado, I will turn things over to Dr. Shinnerman.
Thank you, Sarah. And it's a great pleasure to be here today and share this very timely and important topic with you. First, a little bit more about myself. As Sarah said, I'm graduate program director for the Masters in Biotechnology program at UMBC. I also currently own a consulting firm called CMC Biotech Mass Consulting that assists academic, industry, and regulatory agency groups. I've also previously worked in the biopharmaceutical industry for over 30 years at companies like Novavax, MedImmune, AstraZeneca, and Bristol Myers Squibb. I did my postdoctoral studies at Cornell University, got my bachelor's degree at the University of Maryland in medical technology, and my PhD in biochemistry and molecular biology at the University of Florida. So what we're going to cover today first is a definition of what vaccines are. We're briefly going to walk through the immune system and how it provides immune defenses for the body against infections. Then we're going to talk about what happens when you get an infection. Then we're going to walk through all the different types of vaccines, and you may be surprised to see how many different types of vaccines there are. And then finally, and probably most importantly, how can you get more information from reliable sources? So first, what are vaccines? They are drugs that are meant to prevent diseases, and typically they're infectious diseases that can often be quite dangerous or deadly. They reduce the risk of infection by working together with your body's natural immune system to safely develop immunity against these diseases. So it's kind of a simple definition for something that works in a pretty complex manner. So first, we're going to explore what vaccines are historically through this short video.
The general has nothing more at heart than the health of the troops.
In the early years of the American Revolution, the Continental Army had more to fight than enemy soldiers. Smallpox was raging through the colonies, in some places killing up to half of the white settlers who fell sick, and taking an even deadlier toll on Native Americans, some of whom had been deliberately infected as a weapon of occupation. The British redcoats weren't too bothered. The majority had already survived the disease as children, but American-born soldiers were at great risk. George Washington, who had smallpox himself as a teenager, knew that many people were reluctant to be inoculated or protected by receiving a less deadly form of the virus. But facing devastating losses, Washington wrote to Congress that he had determined to inoculate all the troops and new recruits. This decision undoubtedly saved lives and was probably a big part of why they won the war. Vaccines are one of humanity's greatest triumphs, and their development arose from knowledge across the globe. People have been using antiviral technology for centuries. The type of inoculation they used in the Revolutionary War, rubbing infected pus onto a healthy person to give them a milder case, originated hundreds of years ago in Asia and Africa. Lady Mary Wortley Montagu brought it from Turkey to Europe. An enslaved Black man named Onesimus introduced it from West Africa to North America. In the late 18th century, Edward Jenner discovered that patients exposed to cowpox were then protected from smallpox. He called the procedure vaccination, after the Latin word for cow. By 1900, we had vaccines against cholera, rabies, typhoid, and plague. And over the next 100 years, things really started to snowball. Vaccines offer incredible protection against formerly deadly diseases, and vaccination now saves more lives than any other medical procedure. But how do vaccines work? Let's look at what they're trying to do in the first place. Our natural immune system is pretty incredible. Think of it like a chef with lots of recipes. It can cook up resistance to a whole slew of diseases. Vaccines, then, are like cookbooks, instructions that teach our chefs great new recipes. Most vaccines use either a weakened or dead form of a virus, or a harmless piece of its shell to excite our immune system. They deliver the ingredients for immunity to our bodies. And using those ingredients, our immune systems whip up a recipe to protect us from a virus. So if we ever meet that virus down the road, our immune system remembers how to get rid of it. For decades, researchers have been working on another type of vaccine, a messenger RNA, or mRNA vaccine. mRNA is already inside all of us. Its job is to relay instructions for making proteins, molecules that do all kinds of work in our bodies, like keeping our cells together, helping our muscles move, and protecting us from viruses. An mRNA vaccine delivers really specific and efficient instructions to our immune cells. In the case of COVID-19, the mRNA tells our bodies how to make a spike protein from the shell of SARS-CoV-2, which causes COVID-19. Our immune cells cook up the recipe and voila, produce a harmless but recognizable spike. So our immune system learns how to spot and destroy SARS-CoV-2 without ever being exposed to the actual virus. When the COVID-19 pandemic hit, we were able to develop mRNA vaccines so quickly because researchers have been working on the science behind them for more than 30 years. But a safe and successful vaccine takes more than scientists. For a vaccine to be recognized as safe and efficient, it has to go through numerous tests. The 3 final phases are testing in volunteers, folks from all kinds of backgrounds. Each involves more people at every level, and all new vaccines go through these trials, including the COVID-19 vaccines. Scientists, medical professionals, and volunteers from all over the world made this happen faster than ever before. But even as vaccination numbers climbed in the COVID-19 pandemic, there's more work to be done. People must have access to vaccines and the education to move from hesitance to confidence. It's within our power to end this pandemic, and vaccines will get us there.
The general has nothing.
So let's take a closer look at the body's immune system, which is the body's defense against infection. Your immune system uses a variety of tools to fight infection. Your blood cells are used to carry oxygen to tissues. Your white blood cells are used for fighting infection. And white blood cells include macrophages, which are cells that will engulf invading bacteria or viruses and produce what's called antigens. And these antigens can stimulate the formation of antibodies in your body. B lymphocytes are also defensive white blood cells. They are the cells that are responsible for producing antibodies once the antigens have been identified by your body. And then T lymphocytes are another type of defensive white blood cell. They can actually directly attack invading bacteria or viruses. So this is a quick overview of your immune system, and you can see your immune system is spread throughout your entire body. Basically, your immune cells originate from your thymus, which is in your chest, and then immune cells can circulate throughout your body through the lymphatic system. And one of the places that's identified as a part of your lymphatic system are the tonsils and the adenoids. So that's why sometimes when you have an infection, you go to your doctor's office, your doctor feels the bottom of your neck. He's feeling to see if those adenoids are swollen, which would indicate that there are more white blood cells that are localizing in that place. Also circulating throughout your lymphatic system are lymph nodes, and you can find lymph nodes under your arms or at the junction of your hip, each of the hips at the top of the leg. So again, your doctor, when you have an infection, may feel these locations to see if there's swelling to indicate that the white blood cells are pooling in those areas. White blood cells also will circulate through your intestine to help prevent infection in your intestine. And they can be stored in the spleen, so they can be released as they're needed. There's really the one type of immune system we're going to talk about today is called the adaptive immune system. And in the adaptive immune system, the first step is presenting the antigen to the immune system itself. This usually occurs between a naive T cell and a dendritic cell. So here's the pathogen. It's being presented to the dendritic cell, which causes activation of the T cell. and then the T cells will replicate and differentiate, and then they can form into the different types of activated immune cells, phagocytes, T killer cells, or B cells that will make antibodies. So once again, the key thing you want to remember is that B lymphocytes actually are responsible for making antibodies. And in most cases, when trying to prevent an infectious disease, you want the vaccine to stimulate antibody production. T lymphocytes are responsible for identifying invaders and killing them. And T lymphocytes also can remember the immune response. So many years later, if you're presented with the same infection, your T lymphocytes will remember that infection and cause a more rapid response in your body. So what actually happens during an infection? Well, the first time your body encounters a pathogen, it can actually take a few days for it to respond because your body needs to build up the germ-fighting tools to help you get over the infection. Once the infection has been cleared, your immune system remembers what it learned and can protect you in the future against that disease. That's because a few of your T lymphocytes, called memory T cells, form. And then when your body sees the pathogen again, they can quickly go into action and prevent that infection. So when familiar antigens are detected, then B lymphocytes will produce antibodies against them. So this slide shows you some typical vaccines that are currently available against existing pathogens. You can see we have measles, influenza or flu, and chickenpox. There are currently very good vaccines against all three of those. But what happens when a new pathogen like COVID-19 a few years ago, SARS-CoV-2 a few years ago, caused the COVID-19 pandemic? That's because it was a novel pathogen that no one's body had ever seen before. So no one could immediately produce an antibody against it. So it caused very severe disease. So let's now talk about the different types of vaccines. And you may not be aware that there's actually 7 different types of vaccines. We're going to quickly walk through each one. First is live attenuated vaccines, and this may not be a type of vaccine you're as familiar with. They are commonly used to fight both viruses and bacteria. They're typically a weakened version of either the virus or the bacteria that will not cause disease in people. And that's why it's called attenuated. And it's actually the closest thing to having a natural infection. And that means it's a really good teacher for your immune system. Some examples of live attenuated vaccines include measles, mumps, and rubella, or MMR, and the nasal flu vaccine called FluMist. And these types of vaccines are commonly used for pediatric application. Many children will get these vaccines, but they would not be suitable for elderly people that have reduced immune systems or people that are undergoing chemotherapy because they are immunosuppressed. Inactivated vaccines are a little more common, so you may be a little more familiar with these types of vaccines. These are either viruses or bacteria that have been killed or inactivated using a chemical. And some examples of these types of vaccines would be the inactivated polio vaccine or the flu vaccine. And the most common flu vaccines are the inactivated type. Often, inactivated vaccines require multiple doses, typically 1 dose and then a booster dose in order to maximize your immunity. Next type of vaccine is a toxoid vaccine, and these are meant to prevent diseases that are caused by bacteria that produce toxins or poisons in your body. And when making these vaccines, you would generate a weakened form of the toxin And then your immune system would develop antibodies against the weakened form, the toxoid, in order to fight off the natural toxin. And an example of this would be the diphtheria, tetanus, pertussis vaccine, and particularly the diphtheria and tetanus portions of that vaccine, because they both have toxoids. Subunit vaccines are also very common. Subunit vaccines are usually recombinant, and they will express parts of the virus or the bacteria, usually protein portions, subunits of the bacteria or the virus. And examples of this would be the pertussis or the whooping cough component of the DTaP vaccine, or the shingles vaccine, Shingrix. Next is what's called a conjugate vaccine. And conjugate vaccines are typically used to fight specific types of bacteria. Certain types of bacteria have an outer coating or wall that's made up of sugar-like substances, polysaccharides. And this coating can disguise the antigens on the surface of the bacteria, making it difficult for your immune system to recognize the bacteria as foreign. So conjugate vaccines are effective because they connect the antigens of the bacteria to your immune system. You actually, in the conjugate vaccine, the polysaccharides that are found on the surface of the bacteria are conjugated to an antigen, and your immune system will respond to that conjugate and therefore develop an immune response against the bacteria. And some examples of this are Haemophilus influenza type B vaccine and the pneumonia vaccine. Of course, one of the most widely known vaccines now is the mRNA vaccine. And mRNA vaccines are interesting in that they need to be protected, and we'll see a video about this in a second, but they need to be delivered to the body inside a protective shell called the liposome, or a lipid nanoparticle, so that it can actually get inside your cells and command your cell to make an appropriate antigen. And the mRNA will use your cell's machinery to make a protein. In the case of COVID-19, it makes the spike protein. And then the spike protein is placed on the surface of your cells so that your immune system can be stimulated and produce antibodies against the spike protein. And obvious examples of this would be both the Pfizer, BioNTech, and Moderna vaccines against COVID-19. And then the last one we're going to go over is a viral vector vaccine. These use viruses that are safe and cause no human disease to deliver either DNA or RNA inside your cells and then program your cells to make a specific protein. And once again, this was used for the COVID-19 pandemic. Viral vectors were used to transfer DNA for the spike protein inside cells and stimulate the immune system to make antibodies against the spike protein. And examples of viral vector vaccines are the J&J vaccine and the AstraZeneca vaccine. So let's explore how mRNA vaccines work through this quick video.
We've got two really effective vaccines from Pfizer and Moderna. These vaccines are about 95% effective at preventing COVID disease. So these vaccines work by delivering some of this mRNA into our cells. The SARS-CoV-2 virus got a genetic code of its own. There's a little segment, a tiny little snippet of that actually codes for this spike protein. The spike protein is the thing that helps this virus get into our cells and infect us. mRNA is like a little recipe for how to make that spike protein. When we get these vaccines, our body makes that spike protein and we develop an immune defense to it without ever having to be exposed to the whole virus. It's not exposing us to the whole virus at all, live or killed. It's only allowing us to make a little bit of that spike protein, which is just a tiny portion of the virus, and then we react to that and become protected from the whole virus. mRNA in these vaccines can only get into the main part of the cell, but it can't get into the nucleus of the cell, which is where our own DNA lives. And it can't incorporate into our DNA. And it also doesn't live very long. It doesn't last very long. It's very fragile, and that's why it has to be stored at these ultra cold temperatures. It's not stable for very long. So it goes into the body, goes into the cell for a matter of hours, and starts to make this protein. Then in the coming days, our bodies react to that protein, but that messenger RNA doesn't hang around, nor does it get into our DNA.
So one more quick video here from the CDC that talks about common questions that people have about vaccine safety.
Hi, I'm Dr. Claudia Belozzi with the CDC Immunization Safety Office. Today, I'll provide answers to common questions people have regarding the safety of influenza or flu vaccines. I will begin with the question, are flu vaccines safe? Over the years, hundreds of millions of people in the United States have safely received seasonal flu vaccines. Every year, CDC works closely with the Food and Drug Administration, or the FDA, to ensure the highest safety standards for flu vaccines. For flu vaccines to be approved for use in the United States, manufacturers must meet strict standards to make sure they are free of contaminants and the potency is appropriate. Once the flu vaccines are approved for use, CDC and FDA ensure systems are in place to promptly detect and investigate possible health problems following vaccination. The next question is, who should get the flu vaccines? Flu vaccines are recommended each year for everyone who is 6 months of age and older. People with severe life-threatening egg allergies should consult the medical professionals before being vaccinated. Next, what side effects can occur from a flu vaccination? The most common reaction to the injected flu shot is soreness around the injection site. Other mild problems may include redness or swelling where the shot was given, and occasionally fever and body aches. If these problems occur, they usually begin soon after receiving the shot, may last for 1 to 2 days, and resolve on their own. Common side effects from the nasal spray flu vaccine include runny nose, headache, and sore throat. Life-threatening allergic reactions to flu vaccines are very rare. If they do occur, it is within a few minutes to a few hours after vaccination, and effective treatments are available. Signs of a serious allergic reaction to vaccination can include difficulty breathing, hoarseness, wheezing, paleness, weakness, a fast heartbeat, or dizziness. Syncope or fainting following vaccination can also occur. Vaccine providers should strongly consider observing patients for 15 minutes after they are vaccinated. If syncope develops, patients should be observed until the symptoms resolve. Another common question is the flu vaccine safe if I'm pregnant? Well, the answer is yes. Flu shots are safe for pregnant women and their unborn babies. Millions of pregnant women have received the flu shot over many years. Getting a flu shot protects both pregnant women and their unborn babies from birth up to 6 months of age from flu and related complications. The nasal spray vaccine is not recommended for pregnant women. The flu shot can be given at any time during pregnancy, and it is safe for women who are breastfeeding or who plan to breastfeed their child. Breastfeeding mothers that have been vaccinated can pass the protective antibodies through the breast milk to the infant, which can then reduce the infant's chance of getting sick with the flu. This is especially important for infants less than 6 months old who have no other way of receiving protective antibodies since they are too young to be vaccinated. The next 2 questions deal with the safety of the vaccine ingredient thimerosal. The first question is, what is thimerosal and why is it used in some flu vaccines? Thimerosal is a very effective ethyl mercury containing preservative that has been used for more than 70 years to prevent contamination, such as the growth of bacteria or fungi, in some types of vaccines where multiple doses are drawn from a single vial. Thimerosal is, in fact, an important ingredient contributing to the safety of multi-dose vials of vaccine. Flu vaccines that are packaged in multi-dose vials do contain thimerosal as a preservative. Other types of flu vaccines that come packaged in individual syringes or as individual units do not contain thimerosal. Additionally, the nasal spray and high-dose injectable flu vaccines do not contain thimerosal. So the next question is, should I be concerned about flu vaccines that contain thimerosal? There is a large amount of scientific evidence on the safety of thimerosal in vaccines. Data from several studies show the low doses of thimerosal in vaccines do not cause harm and are only associated with minor reactions, like redness and swelling at the injection site. Furthermore, many well-conducted scientific studies have shown no association between thimerosal in vaccines and autism or neurologic problems in children. We do recognize that parents may still be worried about thimerosal in flu vaccines, and there are thimerosal-free flu vaccines available as an option, both for the injectable and nasal spray types of flu vaccine. Another concern about the safety of flu vaccines involves Guillain-Barré syndrome, or GBS. A common question is, does the flu vaccine cause GBS? GBS is a relatively rare neurological disorder that causes muscle weakness and sometimes paralysis. 3,000 to 6,000 people develop GBS each year on average, or about 80 to 160 cases each week, whether or not they have received a vaccination. Anyone can develop GBS. However, it is more common among older adults, especially those ages 50 and older. Many health conditions have been associated with GBS. About 2/3 of people who develop GBS symptoms do so several days or weeks after they have been sick with diarrhea or a respiratory illness. Infection with the bacterium Campylobacter jejuni, a common cause of food poisoning, is one of the risk factors for GBS. People can also develop GBS after having the flu or other infections, such as cytomegalovirus or Epstein-Barr virus. And sometimes GBS develops following surgery. On very rare occasions, people may develop GBS in the days or weeks after getting a flu vaccination. There are some data that suggest flu vaccination may result in a small increased risk for developing GBS. This increased risk is on the order of 1 to 2 additional cases of GBS per million persons vaccinated. This risk needs to be placed in the context of the known benefits of flu vaccination in preventing flu illness. Finally, you may ask, do flu vaccines cause febrile seizures in children? Febrile seizures can be frightening for a child's caregiver and parents, but nearly all children who have a febrile seizure recover quickly and are healthy afterwards. Febrile seizures can happen with any condition that causes a fever, including common childhood illnesses like the cold, flu, ear infection, or roseola. Since vaccinations may be associated with fever, febrile seizures can also happen following vaccination, although rarely. In general, most febrile seizures occur in children between the ages of 6 months and 5 years, and this age group is recommended to receive flu vaccine annually. CDC studied the healthcare visit records of more than 200,000 children 6 months through 4 years of age who received flu vaccine. The analyses found that febrile seizures following the flu shot in this age group did occur, but were rare. The febrile seizures were most common in children ages 12 to 23 months when the influenza shot and another vaccine, the 13-valent pneumococcal conjugate vaccine, or PCV13, were given together during the same healthcare visit. In this group, about 1 additional febrile seizure occurred among every 2,000 to 3,000 children vaccinated. After thoroughly evaluating this information and assessing this in the context of the benefits of both flu vaccination and PCV13 vaccination, CDC determined that no changes in the childhood immunization schedule were necessary. In summary, CDC places a high priority on vaccine safety surveillance and research. CDC and FDA continuously monitor the safety of vaccines recommended for children and adults in the United States. Flu vaccines have been used for decades and have an excellent safety record. This concludes the CDC video on answers to common questions about flu vaccine safety. Thank you for watching. For more information on flu vaccine safety, please visit the CDC flu vaccine safety page provided here. And for more information related to flu and the flu vaccine, please visit the CDC flu webpage at www.cdc.gov/flu.
So just to finish up, the bottom line, vaccines are very safe and effective, and overall, they are the best healthcare value you can get. Many people believe that naturally acquired immunity, that is actually getting the disease itself, is better than the immunity provided by vaccines. But it's important to understand that natural infections can cause very severe complications, even death. And that most of the reactions seen from vaccines are very mild. And it's impossible to predict who is going to get a serious infection. So it's a much better strategy to get a vaccine to prevent a serious disease than actually to get the disease and get a natural immunity. But vaccines, just like any other medication, can have side effects, but most of them are mild. And as our healthcare continues to advance, we may encounter other diseases like COVID-19 that become very serious. And vaccination is really the best way to prevent future infectious diseases. With that, thank you for joining us, and be happy to take any questions. Okay, so there's a question about why do vaccines have side effects if they're specifically targeting one specific type of pathogen. Like I just mentioned, any type of drug can have side effects. Vaccines are meant to stimulate the immune system, but it's often challenging to get the vaccine to stimulate the immune system to the right degree. If it understimulates your immune system, then you won't have an adequate immune response and you won't develop the antibodies you need. If you overstimulate the immune system, that's where you can start to see some of these side effects. The side effects can be local, like were discussed in the CDC presentation, muscle soreness, redness. Sometimes they can be a little more general, like fatigue, headache, fever, slight nausea. And that can happen with really any vaccine, because if the vaccine overstimulates a person, then it's going to cause some of those side effects. Next question is, which vaccine should those with type 2 diabetes avoid? I'm afraid that's a question you have to ask your doctor. Really would be best to discuss that with your healthcare provider. What are some of the new promising uses of vaccines? So there's a lot of exciting new uses for vaccines, including vaccines are now being used not just for infectious disease, but they're actually being used in oncology settings as well. Cancer vaccines are already on the market and have been quite effective at either treating or preventing certain types of cancers. There also are many novel types of mRNA vaccines that are being developed currently and being tested in clinical trials right now. There are mRNA vaccines that are combining influenza and COVID-19 so that you can get sort of one shot that does both. And I think you'll start to see some of those coming out soon. Can vaccines be an alternative for chemotherapy in cancer patients in the future? That's a really interesting question. It really depends on the type of cancer. Some cancers are best treated with chemotherapy, but there are lots of options in oncology depending on the different type of cancer. There is immunotherapy as well as cancer vaccines. And immunotherapies are meant to stimulate or inhibit specific aspects of your immune system so that tumors can be recognized and killed by your body. So I think the answer is yes, there are vaccines that are being used, and more vaccines are going to be used in the future. But there's also immunotherapy that's an alternative to chemotherapy. Next question. My spouse received a COVID booster and a flu booster in the same arm. Her arm is still hurting after about a month. What could cause that? Is a reaction to the vaccine. Okay, so certainly having soreness in the arm is a side effect of any type of vaccination. If you feel like that symptom is persisting for longer than you would expect, then you should definitely see your healthcare provider. Why is it that some vaccines give us fever symptoms while others just cause soreness? Okay, so that gets back to the question about how much is the vaccine stimulating your immune system? If it overstimulates the immune system, it's going to cause more of the symptoms like fever or headache or fatigue. And it's very, very difficult to get it exactly right, just right, to stimulate your immune system so it just makes the antibodies and doesn't cause any side effects. So every vaccine manufacturer is trying to do that, but it's not easy to get it right to stimulate everyone's immune system to just the right amount every time. Why was there such controversy around the COVID-19 vaccine? Many people felt it was not safe and properly tested on humans. Okay, so the safety of the COVID-19 vaccine was discussed in some of the videos that I showed. There were enormous numbers of clinical trials done by multiple companies, and the safety of those vaccines was clearly demonstrated through studies of hundreds of thousands of patients. The mRNA vaccines are some of the safest vaccines that have yet been created and also among the most effective. They were greater than 95% effective against COVID-19 when they first came out. The reason why the COVID-19 vaccine needs to keep changing is because the virus keeps mutating. And the more it mutates, the more it may disguise itself from your immune system, and it may require a different type of booster. Can viruses that have been attenuated in tissue culture regain virulence once introduced into a natural host? I don't think that is possible. It would require several different independent recombination events in order to reintroduce its virulence. So an attenuated virus has had significant genetic changes made. And in order to get back to its original natural virulent state, it would take a number of large recombinant events to get back there. And that is extremely unlikely to happen in a natural host. Really good questions. Thank you. I think this will be the last question.
Great.
Do individuals with autoimmune disease have trouble with vaccines? Yes, really good question. Often people with autoimmune disease will have difficulty with vaccines. And the reason is that their immune system is already overstimulated. That's why they have the autoimmune disease. So getting a vaccine just kind of makes it worse. So people with autoimmune diseases often will be contraindicated to get something else, get an alternative to a vaccine. All right, really great questions. Thank you. Put the slides back up.
Thank you, Dr. Oh, sure. I think you have one more piece of info about the program, and then I'll close this up.
Yeah, I just wanted to point out to students that if you want to find reliable sources of information, they're listed here. These are fantastic sources that you can trust. I regularly use the Johns Hopkins Center for Health Security, and you can sign up for their listserv, so they will email you regular updates on infectious disease So it's really informative and great information. The CDC, the FDA, and the WHO are also great sources of information. And of course, the best source of information for you is your doctor. And with that, if you have more interest in UMBC programs, you can scan the barcode here and learn more about the MPS and Biotech program. Thank you for your attention.
Please stick around. I have some closing information that I believe you'll find very helpful. I want to offer my sincere gratitude to Dr. Shinneman for this eye-opening presentation on the real-life benefits, health benefits of vaccines. For example, oncology, which I found truly fascinating. And I hope you also enjoyed this discussion today. So maybe you came today because you are interested in preparing for a career in research or health. Maybe you have a desire to make discoveries that are going to change health outcomes for people, or maybe you're in another area. Maybe you are more interested in becoming a teacher or a social worker, or you want to use your business or technology skills in the future to analyze data. Maybe you're a creative type. Whatever your goal is in order to make an impact on the world, I challenge you that there's a place for you to learn and grow here at the universities at Shady Grove. As I indicated when I introduced our speaker and our session today, we are truly a unique and special place to learn. Here in Rockville, on one campus, you can earn a degree from 9 different institutions. What's really cool about that is you apply and are accepted to the institution offering your degree, whether that's UMBC, University of Maryland, Towson, or I'll show you all of those institutions in a moment. But you gain access to top quality professors and curriculum related to whatever your career goal is, and you're able to earn that degree without ever setting foot on a home campus. You get to do that all here in Rockville, as opposed to traveling and commuting to a home campus like UMBC in Baltimore County or College Park or University of Maryland College Park. Students in our program at USG not only benefit from being local, but they earn the same degree they would as at that home campus, but at a fraction of the cost. And we would love to tell you more about that if you'll kind of engage with us. The cost savings are really astronomical. So you can get the same degree here at USG at a drastically reduced cost. Which is great, but we actually take things a step further. We also provide you a full service campus experience here in Rockville, making sure that you have access to everything you need, such as career services, counseling services, health and well-being services, a gym, food services. We have what you need to succeed. And we also help you to access life-changing scholarships that you can't get anywhere else. And so if any of these unique features of our campus here in Rockville resonate with you, including what I didn't mention, small class sizes. We have some of the smallest that you could access. Let's talk about next steps that you can take. So I'm just going to share a couple of really brief next steps for prospective students. And these actually, if you're a current student at USG, these next steps can benefit you as well, because these can help you to explore graduate or certificate programs that will help you to become more prepared for your future. So next steps for prospective students. You have a few different options. First, you can schedule a virtual transfer consultation. These are coaching sessions to help you explore what your goals are and help you learn about how to apply to one of our many different programs here at the universities at Shady Grove. We offer them, you can sign up virtually. We also offer on campus or in-person sessions around the region. We also encourage you, if you've never visited our campus, to sign up for to learn about upcoming events. There are also regular tours you can sign up for, and you can also follow us on our Instagram at the handles listed here. Finally, you're here today because you are interested in learning more about STEM and health or life sciences. We will continue to have more activities like the one you've participated in today. So please stay tuned to your email as we share more experiences that can build your resume around STEM and health and life sciences, help you explore your options for real life application. And then you are just very lucky. You happen to show up for a session today that is on the same night as a monthly virtual info session we host. We love these because they're very social. They give you a chance to understand the transfer process. But what we love about our virtual info sessions is you will, if you come to this, will get to interact with a current student. And so they'll tell you the true life details about what it's like to study on our campus in Rockville. You'll learn about scholarships. And so if you're interested, this QR code will take you to register, and that session starts, I think it's 6:30 tonight. If Mary Kate, if I'm wrong, she can correct me, but I'm pretty sure 6:30 tonight, our virtual info session. And then we're just going to throw out here something for the future. We think if you are not currently a student at USG, you should visit our campus. And if you are currently a student at USG, you can utilize this an excellent opportunity to visit our campus to learn about graduate and certificate programs. So save the date. We have an upcoming open house. This is our largest annual event. We host it every year, and this year it will be on March 29th from 10 a.m. to 2 p.m. And this is where you can find out about all of our degree programs, speak to program representatives in depth, learn about the courses you'll need to take, learn about the benefits of studying here. You can even, in some cases, apply on site. We have fun stuff as well. We do have some great snacks, some great activities, and we always give away some wonderful raffle prizes as well as some scholarships that we raffle away. So this event is March 29th. You can save the date now, and you can actually register using the link on the screen. All of that to say, we really hope that you will consider a future at the universities at Shady Grove. And we hope that you'll continue to engage with us as we discuss learning around STEM. So thank you, everyone. If you have any questions related to the universities at Shady Grove, you're welcome to put those in the Q&A or follow one of the next steps that I shared today. And with that, I will let you all go. But please be looking at your email because you will get a recording of today's session. And with that recording, we have about 3 to 4 questions we'd like for you to answer to let us know how today's session went for you, what you learned, and what you would like out of future opportunities to engage around STEM and health and life sciences. Thank you so much, everyone, for joining us. Have a wonderful evening.